Hello, everybody, and welcome to Dr. Doctor. My name is Mark Strong, and I'm here with Dr. Jill Ginsburg from the North by Northeast Community Health Center. And as many of you have probably already seen the program before, we've just kind of come together to talk about COVID as it affects our immediate community, and then also indirectly as it affects the world around us. And so, Dr. Jill, it's good to be with you today. Welcome.
Thank you. Great to see you again.
Yes. So I guess there's been a lot that's transpired since the last time we've had a chance to converse and to talk, just in terms of our world in general, but then also as it relates to this whole COVID epidemic. And one of the main things, or one of the things that's buzzing the conversation I've heard pretty much everywhere, is about the vaccine that has come out. And so we'd like to just kind of talk about that today to try to help people understand a little bit more about that. And so I think to begin, what is this vaccine? How does it work, and so forth? Just as a layperson, how do I understand this?
Yeah, it's such a great question, and now is the time to talk about it because these vaccines are out in the community. Oregon is starting to vaccinate people today. Today's the first day that Oregonians are going to receive this vaccine. Healthcare workers and some folks working and living in long-term care facilities are the first in line. But yes, this is the week. Monday, 2 days ago, was the rollout of the Pfizer vaccine for the first time. And I think as of today, all 50 states have vaccinated folks. So we've talked about vaccines a little bit, and I just want to remind everybody generally how vaccines work. All of them kind of work on the same principle, which is encouraging our body's own immunity against some kind of foreign invader. In this case, it's a virus. And all vaccines do that. They kind of trick, you could say, trick our immune system into thinking that we've had this infection so that next time we see it, our body is prepared and able to fight the infection off. The vaccines that are available for COVID, the ones that are available now, these two, the one that we are using today called the Pfizer vaccine, and then the one coming out probably will be approved at the end of this week or next week, is made by a company called Moderna. Both of those vaccines are a special technology called messenger RNA. And it's a new technology for vaccines, but they've been working on this for 10 years. It's not like this just was an idea that someone had after the pandemic started. This technology has been in the works for 10 years. And now, amazingly, there are two vaccines that will be available that use this new technology. And it's incredibly cool, partly because it's pretty easy to make these vaccines. And the way it works is the messenger RNA is a little piece of genetic code that is manufactured, and it's sent into our cells. And it basically, you can think of it as a little email message that goes into our immune cells to say, okay, immune cell, if you see something that looks like the spike protein on the coronavirus, you're going to seek it out and kill it. And then, like a Snapchat message, that message disappears. So the messenger RNA is very fragile. It doesn't last in our cells. It doesn't become part of us in any way. It goes away really fast. But it sets our immune cells up with this seek and kill message so that if we're exposed to COVID in the future, our body can fight it off. And the vaccines are incredibly effective in comparison, say, to the flu vaccine, which if we get a flu vaccine each year, and we have to make it new each year because the flu virus keeps changing. If we get a flu vaccine that's 65% effective, we think that's great. We're really happy with that. These vaccines are 95% effective, meaning that when they tested, if they test 100 people, 95 of them didn't get COVID when they otherwise might have.
Mhm.
So that's an amazingly effective vaccine. And the technology part, one thing that people may not know, this technology and the Moderna vaccine that's coming out soon was partly invented by a young Black scientist named Kizzy Corbett. She's a 34-year-old brilliant scientist who's been studying viruses and biology for her whole career, and she had a big part to play in getting these vaccines off the ground, especially the Moderna vaccine. And she's incredibly inspirational. She's got some great educational information. If you're on Instagram, you can go to Dr. Kizzy. I think it's Dr. Kizzy, PhD. Check her out. She feels a big responsibility as a Black woman, she has said, to help people understand how these vaccines work, why they're safe, and definitely worth checking her out.
Yeah. So just to kind of understand the technology a little bit. So basically, this technology is like a carrier. So did they just have to, so to say, input the information about the COVID virus? So with that, what was it called, an RN? What was?
It's messenger RNA.
Yeah,
Is
messenger
what,
RNA.
Mhm.
So are they able to put any kind of information on that genetic material to help fight viruses in the body and so forth, or was this created specifically for COVID?
Well, they've been working on this technology for a lot of diseases and infections, but the coronavirus has some unique things about it that make it a really great for this technology. And the main thing is, if you remember, the virus is that it's a ball, and then it's got those little spikes sticking out of it, which
Yes.
is they're called protein spikes. And those protein spikes are what the messenger RNA targets.
Okay.
So it tells the immune cells, if you see this protein spike, um, this exact one, which they have created in the lab to mimic the protein spike coronavirus, that's a seek and kill message. Find it.
Okay. And so Dr. Jill, like, so if a person's vaccinated, I guess two parts of this question. First of all, what I've been hearing around the community, and I've heard in the forms of jokes. I know one person had put that they received a vaccination from a different country that developed it, and they say I was fine, I suffered no effects. But then by the end of the message, they're speaking a different kind of language. So the joke is that it's going to affect you kind of in a negative way. But just from a scientific medical perspective, is it safe? Is it safe? Because I know there's a lot of concern, especially in the African American community, about the safeness of the vaccine.
Sure. Yeah, and those concerns are very valid, and it's really important that people are able to express their concerns and get their questions answered. I'm a white doctor in my 60s. I have kind of an inherent trust in the healthcare system that a lot of people don't have any reason to think the healthcare system is going to do them any good. And we need to understand that and allow people to express their concerns and get their questions answered. So the vaccine, this messenger RNA is very fragile. It doesn't live in the cell very long. It falls apart. It breaks down. They have to put it inside like an oil capsule, not a capsule, but a little oil with a little bit of fat around it to get it into the cell. But once it gets into the cell, it quickly is destroyed. So it doesn't stay in our cells. It doesn't become part of our genetic makeup. It can't turn us into someone who speaks a different language or change our genetics at all. And with all vaccines, they do lots and lots of testing. Before they give it to people, they test vaccines in animals to make sure that it, to see if it's going to cause any major problems. Once it passes that step, they test it in a small number of people to make sure it's safe and to see if it's effective. Is it producing immunity to the virus? Once that's accomplished, then they test it in lots more people. And these vaccines have been tested in tens of thousands of people.
Oh, they have, okay.
To make sure that they don't cause any serious side effects. Sometimes they see some side effects. They might stop the trial for a little while to look into it to see, was this caused by the vaccine or was it just random? If you have, 50,000 people being followed, some of them are going to get sick, yes, regardless of whether they have taken the vaccine. So they have to figure out, did this person get sick because of the vaccine or was it just random chance? And they have found no serious side effects from these vaccines after studying them for months. This vaccine process went pretty quickly compared to a lot of vaccine development. And part of that is because COVID is so widespread in our communities that they can tell pretty quickly. There's just lots of data about people getting sick and how quickly they're getting sick, how fast the spread is. And they can see an impact of a vaccine a lot more quickly than with a really rare disease. Mm-hmm. So that's helped speed things along. And the risk of serious side effects is extremely, extremely low, but people will get a sore arm from this, and they may even feel crappy enough to stay home from work for a day. It can cause some headaches, some muscle aches, a little bit of a fever seems to be quite common. And they actually think that these are all signs that the vaccine is really working in your body. It's producing the immune response that we need. So when people get, some muscle aches and a sore arm and maybe a little headache, they should feel like, oh, this is good. This is what's supposed to happen. But if you don't tell people that and then they feel, kind of lousy the next day, that's not so great. So we have to be good about letting people know realistically, the vaccine's really important. It's going to protect you over the long run, but in the short run, you may have a day or two of not feeling your best.
Mm-hmm. So typically, what's the duration in terms of the vaccine's length of kind of stay in the body? So if I take a vaccine, is it something I have to do repetitively, or how long does one vaccination last for, or do we know yet?
That's a really good question. I wish we knew. Okay. We know with these vaccines, we need to get 2 vaccines. The first, with the Pfizer vaccine, you get the first one, and then 3 weeks later, you get the second one. The Moderna vaccine, you get the first one, and then it's 4 weeks later that you get the second one, and you need both in order to get the full benefit from it. Mm-hmm. We do not know yet if this is going to be a vaccine like the measles vaccine, where you get it once and you're protected. Okay. Or is it going to be a vaccine like the flu vaccine, where you have to get it every single year to be protected against the flu? And with the flu, that's partly because the virus keeps changing. So it keeps, mutating a little bit. So every year we have to develop a vaccine that's specific for the flu that's in the community that year. We don't know yet if how long the immunity from this new vaccine is going to last. That's something they're watching very, very, very carefully.
Okay. So what's the difference between the Pfizer and the Moderna vaccine? Is the chemicals, structures different, or is it pretty much the same vaccine, just different companies?
It's very similar. It's that same technology with the messenger RNA. They're different companies, and the main difference on a practical scale is the Pfizer vaccine has to be kept at a very, very low temperature, like minus 90 degrees.
Wow.
So that's not that makes it very hard for like a small clinic like ours, for example. We don't have, and we won't have a freezer that is like a super cool freezer. Mm-hmm. The Moderna vaccine needs to be kept cold, but we can use, most of the vaccine freezers that are available will be adequate for that. So there's, there's a lot of hope that it will be easier to transport and administer because of that issue. But the technology is the same. There are some other vaccines in development, lots of other vaccines in development. Some of them use different technology. Some of them use little particles from the actual virus to get our body to make the immunity. And those have, those will have some different transportation requirements. But the Pfizer one is really unique in that needing that super, super cold temperature storage.
Okay, yeah. So if a person, how can, does a vaccine help a person who has COVID, or is it just more so preventative?
Yeah, that's a great question. It's not a treatment or a cure for COVID. It won't help you if you're sick. And we actually don't want people to get vaccinated while they're sick because we don't think it will work as well. So you have to wait a little bit after, if you've had COVID, until you get the vaccine. We do want people who've had the COVID infection to get vaccinated because we don't know how long the immunity from the infection lasts. It seems like the immunity from the vaccine is actually stronger than the immunity from having a natural infection.
Okay.
So people who've been infected, they may not be first in line to get the vaccine. They probably have some protection already, but they should get in line and get vaccinated as well.
Yeah, I think that's an important point too. Just because you've had the virus, it's not simply a one and done situation. I've heard that before as well too. I've had it before, so since I've had it before, I have I'm immune to it. I don't need to worry about it. But is that the case?
We don't know if that's the case. We certainly don't know that is the case. So I think to be safe, we're telling people, even if you've had the virus, you need to get vaccinated. You still need to wear a mask. Even after you've been vaccinated, we want you to wear a mask because we don't know if the vaccine will prevent all transmission of the virus between people. We know that it will help, and if enough people get vaccinated, that is the end of this pandemic. That's how we're going to get out of this, is if we get 75, 80, 85% of people vaccinated. Then we have a really good chance of getting out of this. But until then, we need to keep up with these measures that we've all been doing, the masking, the physical distancing, avoiding crowds, and all of those things.
Mm-hmm. I think one of the things, Dr. Jill, is that there's, as we thought about this, and I just hear some of the conversation that goes on in the community, just in terms of the safety piece and just kind of understanding it. And so I think one of the things is not to try that, where my mindset is right now, is not to try to tell a person to or not to, but in terms of trying to tell people, get as educated about this as you can, so you can feel comfortable making that decision. Is there any resources or any places that you might be able to steer people to, just in terms of finding out, just kind of more information and so forth?
Wow, that's a good question. I think we're going to be seeing a lot of celebrities being vaccinated, on social media and on TV. President is going to, be televised getting the vaccine. I think that's fine, but really what's going to make a difference is people like you, talking to the folks that you're in contact with, and local community leaders being the ones to spread the message. And I agree, we can't tell people they must do something if they're not comfortable with it. And we need to make information available. The medical things that I trust are things coming out of the CDC, the Centers for Disease Control, the NIH, National Institute of Health. They have a lot of good information about vaccines. And then, following people on social media, there's a lot of attention right now given to educating people about the benefits of the vaccine and the safety. And I would just encourage people to watch their social media accounts and try to listen to the people they trust. And if you hear something that sounds off, like either maybe it's a joke or it sounds like it's not plausible, like you get this vaccine and then you start speaking Chinese in a week, if it doesn't sound right to you, check it out with somebody you trust. Talk to a health professional, talk to your pastor, talk to a community person that you think might have some insight, and don't just accept things that people are saying. I've heard a lot that they're injecting this, but it really is a tracking chip. They're not really giving me a vaccine. They're putting a tracker in me. That's not the case. It's not a tracking chip. It's not something evil that's going to give the government an ability to keep on you. It's supposed to help protect all of us. So if you hear something that sounds weird, talk to people about it and try to get some good information.
Mm-hmm.
Yeah, I think, doing something like these videos is really, really important. And I'm glad people are watching and paying attention.
Yeah. I think the information is so important, because a lot of times we have that initial knee-jerk reaction, and it's fear, and once, fear fills our minds, and it prohibits us from gathering the knowledge, the wisdom, and the understanding that we need to really be able to make intelligent decisions to do what is best for us. So I want to encourage those of you that are watching to, read, listen, put on your thinking cap, so to say, like they used to tell us in school. Put on your thinking cap and just process and kind of assimilate all that's out there, so that you understand what's going on and you know how to make a good decision for your health. And I think the thing about this is that, and I was in the store the other day, and people feel different ways, but there was a guy and a gal in there. I mean, just no mask, and they were talking and laughing, and they probably feel like, hey, I don't need this. But the reality of it is that this COVID is not just a personal problem. It's a collective, community, worldwide problem, and our own individual responses or action or responsibility we take can have an effect and impact on others. So I think that just kind of doing your due diligence, gathering information is important. Dr. Jill, now how is the vaccine going to be administered? Who's going to get it? Will a person like me be able to take it? How's all that going to work?
Yeah, and before I get into that, I just want to say I so appreciate those comments about kind of our collective responsibility for each other. We wear the mask to protect ourselves, but we also wear it to protect our loved ones and the people around us who we don't know. We get vaccinated, we get our flu shot to protect ourselves, but also to protect the people we love who are close to us and the people in our community. And the same is going to be true for this vaccine. I'm going to take it to protect myself, but also to protect all of my patients, my staff, the people in my family, and all the people in my community that I come in contact with. Mm-hmm. So we're, the first people who are getting the vaccine today are people in high-risk medical situations. So people who work in the emergency room, in the intensive care unit, in COVID units. And I believe they're also giving some vaccinations in long-term care facilities or nursing homes, because that has been a big source of infection and a lot of people have died. So there will be enough vaccine for everybody, but it's going to take some time. It's not going to be, you're probably not going to get the vaccine this year. I probably won't get it this year. I hope to get it early next year, and I'm hoping that there'll be lots available for people in the first months of next year. But we're hoping to start be able to administer the vaccine from North by Northeast Community Health Center. Community groups are going to be key in getting this done, because a lot of people don't want to go to a big hospital to get vaccinated. They'd much rather go to their church or their barber shop or their small neighborhood health clinic. And that's where we really have to put a lot of our energy to getting the vaccine out to these community sites and getting as many vaccinations in people's arms as possible.
Mm-hmm. So it's going to be a process, and it's not going to be an overnight thing, but it's going to take a little time, for it to kind of trickle down and everybody be accessible to be able to get it. So in the meantime, Dr. Jill, um, how do we continue to maintain and be safe, in this COVID climate?
Yeah. I think, I think there's a lot of nervousness out there that people, now that there's a vaccine, people will think, oh, I don't have to do any of the things that I've been told to do all these past months. And it's the vaccine is like a bridge getting us from where we are now to the other side of this pandemic. But that's a long bridge. It's more like a tunnel, maybe.
Yeah.
There's a light at the end, but the tunnel is long and it's going to still be dark. We're going to have some dark months ahead. Yesterday, we had a record number of deaths in Oregon. 54 people died yesterday from COVID. We're going to see a lot more infections and a lot more people dying. So we have to continue to do and double down on the things that we've been doing. Wearing masks at all times when we are around anybody who's not part of our family. So that's anytime we are at an indoor, any kind of indoor gathering, any store, a drive-through, anything where you are in contact with other people, the mask is the #1 protection. And then really limiting our contact with other people who are not part of our family that we live with. That is very difficult. It's hard to talk about that coming into the holidays, the
Yes.
Christmas
Yeah.
season. We want to be together. We've been together, every other year, and we don't, this year is different. I am hoping that people will stay home this Christmas so that we can be together next Christmas.
Yes.
Too many people got sick over Thanksgiving, and some of them sadly won't be here for next Thanksgiving.
Yeah.
I don't want that to happen to one more person.
Mm-hmm.
So keep washing your hands, stay away from folks, stay away from crowds, wear your mask, and we will get through this.
Yeah. I got a question for you. How effective is like hand sanitizer? So if you can't wash your hands, so like if you go to the store, you've touched a shopping cart, you've handled money, you've pushed the keys on the, and you go back to your car, is hand sanitizer good, to help in that process? I mean,
yeah, definitely sanitizer it's very good. It may not be quite as washing your hands, but it's definitely effective. And yeah, if you go to a store and you are handling your groceries or whatever, a lot of stores have hand sanitizer available. Take some squirts of that before you walk out to your car. Leave some hand sanitizer in your car, so when you get to your car, if you haven't been able to do it before, do that. And then when you get home, wash your hands, put your groceries away, and then wash your hands one more time after you've finished touching everything. And that should be adequate.
yeah. And I
Yeah.
just want, yeah, I just, just to tell everybody, I feel you. I feel your pain. You get tired of putting a mask on every time you go out of the house. You get tired of being confined in your four walls. It would be nice to be able to go to a restaurant like normal and just sit down and eat, and just enjoy yourself, or go to a movie or that type of thing. And, not worrying about, can I become infected, that kind of thing. But, I'm a pastor, and there's a scripture that says, like, be not weary in well doing. And so as we are, engaged in this COVID season, we don't want to get weary in well doing, and we don't want to take on a false confidence. We're thankful that a vaccine is available and becoming accessible to us, but we don't want to have a false confidence that says just because there's a vaccine out that everything's going to be fine right away. I like what Dr. Jill said. It's going to be more so a dark tunnel that we have to go through. And so while understanding that, even though you get tired of the mask, keep on wearing it, keep on washing your hands. Like Dr. Jill says, it's better to miss this Christmas so we can be around the following Christmas and the Christmas after. This is a real situation. It's a real situation, and many families have been affected and impacted. And so we want to do all that we can do to try to keep ourselves safe, but then also keep our community and the world around us safe as possible too. And so we have that ability to be able to do that. So if we just can all do our part. I just have one more question, Dr. Jill, just in terms of the vaccine and COVID. So if a person has already had COVID, do they still need to get the vaccine, even though they've had COVID once already?
Yes, they should. We don't know how long the immunity from a infection lasts. And from the research, it looks like the vaccine gives better immunity against future infection than getting COVID. So we will recommend that people who have been infected get vaccinated. Not first in line, especially if you've just had COVID, you're going to need probably a few months to get vaccinated, so the vaccine can really take effect. So you may not be the first one to get it if you've already with COVID, but you should get it at some point when it's available, for sure.
Okay. Well, we've covered a lot today and talked about a lot of a heavy topic and something that impacts us all. Before we close out today, Dr. Jill, you have any more closing thoughts or anything you'd like to say before we tune off for today?
Thank you for another great conversation. I'm so glad to be able to talk about these important issues, and I look forward to seeing you again soon.
Yes. And what we're going to try to do here, we're going to try to do a Dr. Live, so that those of you that are watching, if you have questions or comments for Dr. Jill, that you can be able to get a hold of her while she's here on the screen and answer those questions. So just stay tuned for that. We'll once we get it dialed in, we'll put up a post on our pages to say what day and what time it's going to be, and then you can tune in with us live, and we look forward to hearing your questions. So thank you today for listening, and we just encourage you to continue to be safe, wear your mask, wash your hands, stay 6 feet apart, and just keep loving yourself and also loving others. And we're going to get through this, everybody. We will get through this. So thanks for watching Dr. Jill. Dr. Jill, thank you so much.
Thank you.